Welcome to our episode today. Today I have Dr. Augsburg Habila in our virtual studio, and we'll be talking about healthcare access, mobile technology. So I'll go through your bio very quickly, and then I would then ask you the questions. So Dr. Augsburg, a tech innovator and CEO of Surjen Healthcare, which you are going to tell us much more about later, a company dedicated to expanding healthcare access through digital health solutions and community-driven services. You have a strong foundation in clinical practice and in healthcare leadership as well. And you've been in NGO programming, a lot of humanitarian services, healthcare management, then AI-driven diagnostics, offline services, and a lot of things to discuss. So nice to meet you, Dr. Oxlock. Thank you and welcome.
Thank you so much, Mr. Gilbert.
Now let's go through the first question. You seem, to have blended everything I've mentioned so far, the tech with the healthcare, with the clinical practice, with the traditional
Mm.
medicine as well. So, how have you been able to do this? And then now have you been able to transition that and transcend that into your tech driven solutions?
Thank you so much for that question. I've always been inspired by medicine and tech. Um, while I was growing up, actually, what I wanted to study was computer science. But then I didn't like the end game of computer science graduates that I saw in federal universities because it felt like if you study computer science in a federal university, then the highest point would be opening a business center or working in some of those telecom companies. I mean, how how short-sighted I was. But yes, I've always been passionate about medicine. I mean, I watched my first surgery when I don't want to mention the age before they would come for me, but I watched my first surgery while I was pretty young. And ever since, I've always been exploring ways to, bridge the gap between medicine and tech, since these are two things I'm passionate about. And I quickly realized that one of the main challenges in healthcare in Africa is not just about treating disease, but it's the access. People don't have access to that healthcare, from the long waiting times to difficulty in finding specialists to the transportation barrier. I mean, especially in the rural regions. So, I've realized that tech is the bridge to, introduce digital health and bridge that gap between patients and specialists.
Okay, okay. So I mean that's quite interesting, and it's good to know that you've been in the game for a while, and
Mm.
you watch your surgery very early. So that means yes, you're in tech now, but you have um, that how would I put it now? A long-term view of, you've been in the game for a while. You understood, kind of understand how we've arrived in the AI, driven system that we have now. AI is there, the machine learning and a lot of things. So, can you tell us, the shifts you've
Mm.
seen, like things you've witnessed, and how you've been thinking about these as well? Like, okay, this is what happened, then this leads to this, then this leads to that. Then I got interested in this. I think this was the genesis of this. Do you just give us a overview, across the years, that you've been practicing in clinical medicine and even out of the clinical setting?
Okay, well, the biggest shift I've noticed is technology is democratizing healthcare. It's making it accessible to everyone now. It's not just something for a particular group of people. It's not something for people living in Lagos, people living for Abuja. I mean, the same care people get in Abuja, in those physical hospitals, the same care is also accessible to people from far rural regions. And this is because of the telemedicine and AI diagnostics to the electronic medical records that are being used. And there's been growing trust in digital health because that has actually been an issue, but with that shift, the shift also comes with a right-handed shift, meaning people are also gaining trust in digital health and telemedicine.
I think the trust in it's a trust that has come with the growth in technology, actually. So I think the same way we now trust more
Exactly.
fintechs, the same way we now trust more edutech is the same way we trust in um, health tech services and solutions as well. So now, how easy was it for you to arrive where you are now in your kind of work that you do now? Like, how were you able to transition? Like, how easy was it for you? What did you do?
To transition
Yeah,
to
like how easy?
transition from medicine to
Yeah, like core
okay,
practice
I understand.
to the kind of things, you know.
Yes, I would say I'm a doctor, but I don't consider myself like a tech person because what I'm just trying to do, I feel what I'm just trying to do to treat people, do locums and whatnot. But what I'm trying to do is just to bridge that gap between medicine and tech. And the transition for me wasn't really difficult. Back in medical school, I was the guy that classmates were meeting to flash their phones or to do something with their devices. So somehow that tech was just in me. Health tech is a way for me to, bring those two principles together because I don't see medicine, tech, and other things I do as separate entities make up a person. And that's what I'm just trying to do.
Okay, okay. Your internet is breaking up a bit, but I think I can still hear you. So now, let's talk about healthcare access in resource limited settings in various areas where you're working where the internet isn't. Speaking of internet,
Hmm.
where they don't. Speaking of internet, like how are you able to like mainstream your solution into this various area where you have to like do a lot of offline
Hmm.
service. And also, like, give us
Yeah.
a feel of what you are really, really doing in terms of product and services. So be specific on the product and
Okay.
services, and now you're able to take them to those peri-urban and rural areas.
Okay. Internet connectivity has always been a problem. I mean, even in urban areas. I mean, I'm talking to you from Abuja, and you can see how my internet connection is. So imagine that same connection being in rural areas. It's even worse in rural regions. So right now we are working on introducing USSD codes so that people who are in, let's say, rural regions who don't even have access to smartphones to access our websites or download apps where they talk to specialists, they would still be able to reach out and still get those same services with USSD codes where they'll be able to book appointments, order lab tests, and the same experience you get on the website, you should be able to get that on the ESSD codes.
Mm,
And we are also working on an AI chatbot that will be integrated to our website and also our WhatsApp groups, which would help streamline a lot of processes. And because the for AI chatbots, I think they're just it's right now they're like the tip of the iceberg. We
yeah,
don't really
yeah.
see the potential. So a lot of issues around it, but it's still something we are working on. Even if it's not doing the serious work yet, it could answer certain questions that people always come to and ask. It could pull information from the website and then have the answer to those things
Mm,
and would be able to, just streamline lots of processes.
mm. Okay. So now in terms of you developing that AI chatbot, and what are these problems or what are the obstacles you face in terms of maybe gathering data, maybe legal issues, understanding the system? Like, just give us a feel of how what the problems are. So let's say someone is trying to do something like that,
Okay.
and then how you're able to overcome those challenges.
Mm. There are a lot of challenges, and the challenges they vary from region to region. And I think that's the mistake a lot of telemedicine platforms make. Let me use the AI chatbots we were just talking about right now. A lot of people would adopt the same AI chatbot used in, let's say, UK or US to be used in Nigeria. But in as much as those chatbots are very good at their job, they can be biased in the sense that the data they have been trained on. Most of those apps are trained on data in the US and the UK, those places that have systems that keep track of their data properly. But in a society like ours where um, there's many concerns like the data privacy, cybersecurity risks, and lack of proper electronic health records. I mean, we've heard of cases where banks are having cybersecurity problems. So it's actually a big issue. And apart from the data privacy, the trust and adoption, patients still believe that the only way they can be treated or gain or have proper management is if they meet the doctor physically.
Mm.
And I mean, I won't fault them for thinking about that, but with what we've seen, we can see that okay, there are some cases where patients don't actually need to come to the hospital. What telemedicine is trying to do is not to, just transform the whole system in a way that patients don't have contact with doctor. But what telemedicine is trying to do is to give access to everybody.
Mm.
Because if everybody keeps coming to the hospital, there are people that don't have serious condition that just a call away,
Mm.
you could prescribe a medication or some management steps, while there are people that actually need to come to the hospital. So imagine someone that actually needs to see a doctor has to wait a couple of hours because there are other people that are being seen by the doctor already.
Mm.
So the trust and adoption is also a big deal. And the low digital literacy is also a big deal because a society like ours, we have a lot of people that are not tech savvy or didn't go to school. So a lot of them may have to be trained on how to use these platforms. Now, that's where the previous thing we talked about, bringing different avenues for people to access this service, like the use of the USSD codes,
Mm.
which would be helpful. But then, how would you deal with a patient that doesn't read, doesn't read English, doesn't someone that didn't go to school? So, in addition to that, avenues of platforms that are able to transcribe whatever it is, multilingual support, it's actually very, very important too. So it's like the multilingual support would solve the problem of the language barrier because I mean we have tons of languages in Nigeria. So very important. These are some of the challenges and yeah.
I think a key challenge that I would want us to zoom in on is the ethical issues here now. So, what do you think the concerns are in terms of managing data,
Hmm.
like data governance?
Yeah.
So, what do you think anyone trying to do anything around this should watch out for, and what are your suggestions on how to navigate that?
Okay. I think I'm not so sure of the whole telemedicine regulations in Nigeria, but I know that data privacy in Nigeria is still developing, and we need to be proactive in cybersecurity measures. Because I feel if the government takes telemedicine seriously, like if we see that telemedicine would actually bring a lot of impact, it's not just hype and it dies down, then a lot of investments would be pulled towards, you know, making sure that people's data are protected. There was a study that was done in, I can't remember the school, but I think it was in Ibadan. I'm not sure of the school, but it was saying that about 74, I'm not sure of the exact value, but it was 70 something percent, 70 something students. The major reason for them using a telemedicine or digital healthcare platform was that if they were assured that their data
Mm.
was 100% secured and immune from cybersecurity attacks, they would definitely use the platform. There were other reasons as well, but that was the major reason. And yeah, so for the issue that we've been talking about trust, AI has to be transparent because a lot of people don't know what happens back end. Like when chatbots are being used, a lot of people don't understand the back end. And like I mentioned, we need to make sure that bias is not introduced. A
Mm.
lot of these chatbots that are founded by people in US, UK, and whatnot, they were trained on data sets particular to their environment. So if you're adopting their AI or chatbots or adopting their APIs, there would definitely be bias.
Mm.
as long as they have not been trained on data sets from our environment. Because you can't, a chatbot that has been used to whatever disease that they mostly face, you can't be talking to that chatbot about malaria. And the chatbot, a lot of them may not tell you that they don't have this data, but they will just want to tell you something about it. And if people can Google their symptoms and come up with diagnosis of cancer,
Mm.
then imagine what will happen if they are working with a biased AI chatbot.
Mm. So I think that's
Yeah,
an
so
interesting thing. Yeah.
transparency. Yeah,
You're talking of,
transparency is very key.
yeah, so you're talking of transparency in terms in training the data, something like, yeah,
Exactly.
supervising the data, training
Exactly.
the data, and rewarding it and all that. Okay, that makes sense. So now let's take it let's make it light a bit and talk about what your advice would be for anyone trying to do this kind of thing. Probably someone in undergrad level,
Mm,
or just coming out of NYSC or just coming out of university, and or maybe they've even started something and you're not sure what to do. And I mean, what's your advice would be in terms of taking something from zero to a level that you have it now?
mm. That's a very good question. The first thing I believe is starting small. No matter what resources you have available at the moment, make use of what you have. Because a lot of people, when we have ideas or things related to tech, what we think about is funding, getting all those big fundings. But I believe you shouldn't wait for fundings. You can start with something basic, niche down to a particular problem you're trying to solve. Even if it's a big idea, break your ideas down into small, actionable goals that you can achieve and know that, okay, you're actually moving forward.
Mm.
Another thing is when I say break down on the niche, breaking down on the niche involves identifying a particular problem. Don't just think of like a big, broad whole idea that is coming to save the whole healthcare industry in Nigeria. What particular problem are you trying to solve? You can start from there and then, start building on that.
Mm.
And another thing we need to understand is collaboration. Collaboration, both in terms of using tech or using or collaborating with other humans. Because a lot of times we want to, let me do this myself and let me take the glory. But I understand that collaborating with humans is dynamic. A lot of people would demand for, funds to even start working on an idea that you have. But there's a way you can build a cycle, make those connections during your NYC or even in school. In 100 level, in 100 level, everybody does courses together. Computer science, everybody in science does courses together. All those friends you made in 100 level that are doing computer science now, a lot of them are gurus now. They are bat guys.
Mm.
Collaborate with them. Collaborate with there are a lot of AI tools that do a lot of work that you needed high-end top software programmers to help with that. But there are a lot of those tools out there that would help.
Mm.
So doing your research and just collaborating both with medical experts, developers, and anybody that would bring value.
Okay. And I think to our last question. So speaking of collaboration,
Hmm.
what do you think? I mean, can you give us a little bit of what you do more, and then tell people how they can collaborate with you, what you need collaboration on, maybe
Hmm.
research, whatever partnership or something. Just give us a little bit about what you do and some areas where you don't mind getting people to reach out to you, and now people can also reach out to you as well.
All right. Right now, I'm the CEO of Surjen Healthcare, and Surjen Healthcare is a digital healthcare platform that bridges the gap between healthcare and patients. So we make healthcare available to patients at their doorstep. That's basically what we do in Nigeria, in India, in Dubai. Being a health tech innovator, I'm a medical doctor. I'm also a professional guitarist and a music producer. So those are other things I do as well.
Okay. And now can people reach out to you? if there's any, thing to reach out to you for maybe partnership or something. So how can people connect with you and reach out to you? Can you hear
Yes,
me?
I'm on LinkedIn. I'm also on Instagram and other social media profile networks as well.
Okay, thank you so much. I think that will be all for now. May still reach out again some other time for maybe follow up or discussion. But I think we've had awesome discussion about telemedicine.
Thank you so much.
Yeah, thank you so much for your time. And yeah, we'll tag you as well when we post, and hopefully we see some engagements and we'll take the
All
discussion.
right.
Thank you so much, and that'll be all
All
for
right.
now.
Maybe next time I'll interview you.
Oh, that's fine. No worries.